Welcome, everybody. We even got Ann Siebert out. Yeah. Hey, thank you so much for joining us here today. And I just want to say, without you, we would not be here at this moment. So as your governor, I am honored to have you here. And I can't tell you how much I appreciate the hard work that you've done to get us to this point. I'm not going to make the mistake of doing the thank yous, because we'd be here for 48 hours. So you know who you are. Thank you from the bottom of my heart. We gather here today to launch the first single-payer healthcare system in America. To do in Vermont what has taken too long. Have a healthcare system, the best in the world, that treats healthcare as a right and not a privilege. Where healthcare follows the individual, isn't required by an employer. That's a huge jobs creator. Where we all win and we all pay. Most importantly, a healthcare system that is sustainable, that spends our healthcare dollars making Vermonters healthy, not on insurance company profits and not on waste and inefficiency. We will get this done in Vermont. We have a few challenges, and I believe that taking on tough issues, getting tough things done, is going to lead to a bright future for jobs and economic opportunities for all Vermonters. As a business person who comes to this job as governor from small business, I know firsthand that the biggest obstacle to job growth is the 10, 20, 30% increases in insurance premiums, where we as employers who so badly want to cover our employees consistently send more and more money to insurance companies for less and less coverage, asking Vermonters, our employees, to pay more and more of their share in an unsustainable system that will both bankrupt us and make it impossible for our small rural healthcare providers who do such a great job delivering quality care to survive in a small rural state. Our hospitals, our doctors, our nurses, our diverse healthcare community, along with our small businesses, cannot survive under the current system. That's a big one. We need to fix it. This bill will. And I want to say a word to the many Vermonters that I meet every day. The 40,000 who have no insurance coverage and wake up every morning wondering whether this will be their day. The 150,000 Vermonters, that's 1 in 4 Vermonters, who wake up every day knowing they have insurance, but knowing that they're underinsured. That if they really get sick, and eventually, unfortunately, we all do, that when that day comes, they may lose their house, their car, their economic security, because underinsurance is no insurance at all. That's what we need to fix. So this bill that we will sign shortly is both an opportunity and an obligation. It's a challenge to all of us to design a cost containment system that'll work. Folks keep saying to me, well, you got to ration care. You got to pay your health care providers less. I keep saying, no, it's not about reducing care. It's about paying our providers enough so that they can thrive, so that our doctors and nurses and healthcare providers can do healthcare again instead of being second-guessed by insurance companies and under-reimbursed by a healthcare system that is driving them out of practice. Healthcare providers want to do what they were trained to do, make you healthy. This bill is going to give them the chance to do it in Vermont. It's going to bring them to Vermont. It's going to allow them to do what they were trained to do, deliver quality healthcare to Vermonters. Let's get that done. We wouldn't be here today without the help of many of you. And I'm going to first take my hat off to the Vermont legislature. At a time in America where politicians do more partisanship than they do getting things done for their constituents. At a time in American politics where we are all fed up with the lack of progress, with a lack of common sense, with a lack of compromise, and with a lack of unity, this Vermont legislature did what no other legislature is doing. Came together, worked together, debated real issues, and passed this bill. And that is a tribute to democracy in Vermont. We're going to hear shortly from some of the folks who made that happen. The Speaker of the House, Shap Smith, the President Pro Tem, John Campbell, and the chairs of the healthcare committees in both the House and the Senate that did extraordinary work to figure this one out. Representative Mark Larson and Senator Claire Ayre. To all four of them and the other 146 members of this legislature, I can't tell you how grateful I am. Did I get the number right?
Well, I think you forgot the Senate.
Oh, what about the Senate?
Small little body, you might
Sorry.
remember.
Got to remember, I started out in the House. We don't forget our roots, right, House members? That's right. They always accuse me of running the Senate, and I just annexed it, right, John? 176 is never what we were looking for. First, we're going to hear from a few of the folks that helped make this moment possible. Dr. Deb Richter, who came to Vermont as a doctor from New York, knowing that after watching patients suffer, after watching patients lose their life because of a lack of coverage, she decided, out of the 50 states, to go to Vermont and make people healthy, and in her spare time, work for a single-payer healthcare system that was going to allow her to practice medicine again and make sure that no one lost their life from a lack of coverage. Without Deb's commitment, we wouldn't be here today. And she speaks for so many others. Ellen Oxfeld, James Haslin, the entire team that's worked so hard, obviously the folks at VPIRG. You'll be hearing from Cassandra Gekas, from the healthcare advocate from VPIRG. Cassandra did an extraordinary job. Jennifer Schneider, who was diagnosed with cancer, ovarian cancer last year, and will share her story with us. Thank you, Jennifer, for your courage. And Julie Leinberger from Windham County, who is a business person who understands this from the inside. I give you Dr. Deb Richter.
Well, I must say, on a personal note, this is probably one of the better days and best days of my life. I would say, and I think on behalf of the primary care physicians in this state and all of the patients that we have tried to serve in this broken system, this bill is such a major step forward. And again, establishing health care as a public good is not anywhere in this nation do we consider it that. We consider health care a commodity to be bought and sold on the marketplace. But we're going to hear all kinds of scare stories that this is a thoughtless experiment or that it is too bold. But I would remind you that every other industrialized country does what we are trying to do, and they do it for far less money. They live longer, and they get better quality care. So it's time for Vermont to join the rest of the industrialized world. So there are many people to thank for getting us this far, as the governor mentioned. There are many organizations that worked for years to get us this far. But one of the main reasons we are here today is because we had the legislature that decided that this was the right thing to do, led by Speaker Shap Smith and Senate Pro Tem John Campbell, and we owe them a huge debt of gratitude. And they made this their top priority. And to all the legislators who voted for this bill, we thank them profusely for doing that, because it was bold, and they stuck their necks out, and we have to stand behind them and endorse their candidacy. But really, the special thanks, in my view, goes to our governor, Peter Shumlin, who made a pledge. If he were elected governor, he would make Vermont the first state in the nation to enact a single-payer, publicly financed system that pays for health care for all Vermonters. And how many politicians do you know that really do what they say they're going to do? We will hear this is an impossible goal, but all along, people have said that it was impossible to get this far. But here we are. And now the real work begins. We have a long road ahead of us to get this bill in place. Let's get started, but after the party.
Thank you, Deb. I now give you Jennifer Schneider. Jennifer, thank you so much for being here.
Okay. Hi. Sorry, but I am going to look down at my paper. I apologize, but it's going to happen, or else you would all be very sorry. My name is Jennifer Schneider, and I want to take this opportunity to thank you for letting me be a part of this historic moment. Yay. It's going to help make sure every Vermonter gets the care they need, when they need it, where they need it, and at a price that they can afford. In August 2009, at age 40, I was diagnosed with late-stage ovarian cancer. The toll that this illness took made me unable to work full-time, which I wanted to continue to do, which meant losing my health insurance. I wanted to stay involved and work part-time, but knew that it would price me out of state health care programs like VHAP and Catamount. Facing no other choice, I quit my job and enrolled in VHAP, which luckily covered much of the treatment and tests that I needed to try and stay healthy. So luckily that worked out. Fletcher Allen was very helpful. During the period of my diagnosis, my mom's health was also in decline. She had uterine cancer and she was being treated in New York City. Not only was I stressed about my own diagnosis and facing the reality that I was losing my mother, but we both had to fight the insurance system to make sure that our care was covered. I had surgery in December of '09. In January, my mother's health took a turn for the worse and was in the ICU. I wanted to spend time with her in New York City, but was in the middle of my own treatment. I tried my hardest to schedule my chemo at Sloan Kettering so that I could be close to her, but they would not accept my health insurance. A private oncologist down there, my mother's oncologist, said, well, we could do it for you, but it'll cost $10,000 for one treatment. I said, no, can't do that. So as a result, I had to leave my mother and my family just for 2 or 3 days, but it was one of the hardest things I've ever done, is to leave her in the ICU with tubes in her, it was bad, tubes in her mouth, she couldn't talk, she knew I was there. I said to her, I'm leaving, I'll be back in a few days. Stay alive, please. So I flew back to Vermont, got my treatment. My oncologist was wonderful and very sympathetic and knew there was nothing he could do to help me get treatment down there, which we tried to do. The bottom line for me and thousands of others is that whether you have money or you don't have money, whatever your circumstances are, you shouldn't have to worry about whether you're covered, whether you have health insurance. Under Green Mountain Care, our new single-payer system, this fear and stress will go away. And Vermonters will be able to rest easy, knowing they're covered whether they get sick lose their job, spouse, or other life-changing circumstances. Because as many people know, when you're stressed, everyone around you gets stressed. And if you have a partner, that makes it's very difficult. They watch you suffering, and it becomes a sort of a whirlwind. Coverage restrictions, out-of-pocket expenses, paperwork, and processing are the result of our current healthcare system and have kept many of my friends, strangers, colleagues from getting the care they need. What I've realized is that until you face a lot of these challenges, you don't take action, which I know thousands of people do, thanks to Cassandra Geekus and many others. People do go and they take charge and they try to make changes. And for me, it was now seeing my illness, my mother's illness, that has led me to see how much more broken the system is than I actually thought when I did know it was broken. So, thank you to the governor, legislators, and advocates who passed this law, putting us on the path to a publicly financed universal health care system. It will make all this difference in the world to Vermonters and their families, whether they are sick or healthy. And we are all just one test away. Thank you.
Julie Lineberger is a business person in Windham County, an architect, and chairs the VBSR board. Thank you, Julie. Where are you?
Right.
Come on.
Thank you. Vermont, once again, is leading the nation in its tradition of independent thinking. We've done this many times before, with being the first state in the nation to ban slavery, to incorporate universal education, to enact civil unions, and then have marriage equality without a judicial order. We're also one of the first states in the nation to enact a socially responsible charter so that businesses can incorporate as a for-benefit corporation. Truly, this law we're signing today is more than a healthcare law. It is economic development for the state of Vermont. With an equal playing field, Vermont businesses can play on the global marketplace. When our businesses no longer need to spend 15 to 30% of their payroll on health insurance, we can invest back in more Vermont employees and higher wages. Vermont also leads the nation in a very special business organization that believes our success is measured not only by the dollar, but also in how we treat our employees, how we interact with our communities, and how lightly we walk on the earth. With over 1,200 business members, Vermont Businesses for Social Responsibility represents approximately 15% of our workforce. We are the largest, most active business for social responsibility in the United States, leading the way for others. As VBSR board chair, I am honored to be speaking today. For 20 years, we have it in our records, VBSR and a multitude of people have worked to decouple health insurance from paychecks. Who is it that decided that only those working for certain companies were worthy of proper health care? The law about to be signed is a culmination of many people's efforts. It's an example of how governmental bodies, nonprofit organizations, and leading the pack, businesses can work together to affect positive outcomes. Our nimble state of Vermont is making changes where other states waffle. Thank you, Governor Shumlin, for your vision, foresight, and commitment. Thank you, Dr. Deb Richter, for your endless, tireless energy and moving to Vermont, where one person really can make a difference. Thank you to all House Committee members who worked for balance to bring this to the floor under the leadership of Mark Larson. Thank you, Senator Claire Eyre of the Senate Health and Welfare Committee, leadership bringing this to the Senate vote. Thank you, House Representatives, and your Speaker, Shap Smith, for starting the ball rolling. And thank you, state senators and your leader, Pro Tem John Campbell, for guidance through the Senate. This business community applauds you. The nation is watching you. With this law, you sure have created a lot of hard work for yourself, And everyone here is ready to roll up their sleeves and help.
There have been so many advocates that have worked so hard for this bill: doctors, nurses, providers, business people, and labor, and so many others. But so it's a little dangerous to choose a few, but I do want to introduce now someone who did a tireless work on this bill, as did the organization, Cassandra Geekus with VPIRG. Cassandra.
Thank you. And wow, it is such an honor to be here today. There are so many people to thank, but I'll try not to turn this into an Academy Award speech and thank everyone on my list. But most definitely have to thank Governor Shumlin, legislative leaders, and all the advocates who helped us achieve this, and I'm grateful to be here with all of you on this historic day. VPIRG is the largest consumer protection and advocacy organization in the state. We represent over 30,000 members and supporters. And our members, like thousands of Vermonters, understand the failures of our healthcare system all too well. The statistics that you've heard about growths in healthcare spending have made it clear that for Vermont, maintaining the status quo is just not an option. Change is necessary for the health of our families, for the communities, and for the state budget. And it's not just Vermonters that are excited about what we're doing today. Citizens, advocates, and decision makers across the country are watching us. First, because we're tackling a problem cost control and universal health care that no one else has been able to solve in the country. Luckily, we have the resources, the political will, and the ground support to tackle this issue head on. And if successful, we will no doubt change the tone of healthcare discussions and the debate across the country, and help other states feel like this type of monumental change is possible. As many have said, this bill is a first step in a multi-year process, but one of the most important things we're doing here today is laying out a clear vision for where we want to be. And this vision for Green Mountain Care is something that I think most Vermonters are very excited about. Imagine a world where families touched by illness can focus on healing rather than losing sleep over whether or not they can pay their medical bills. Imagine a doctor's visit where you can spend more time discussing your treatment and health than you sit in the waiting room filling out paperwork. Imagine being able to face life's changing circumstances like job, marriage, or illness without being terrified that one sickness is going to send you into bankruptcy. It's really inexcusable that we live in a society where the good people that grow our food, that build our houses, support our children, still do not have access to health care. And I think Vermonters are really hungry for common sense solutions, for reasonable discussions, and straightforward answers to their health reform questions. And that's exactly what this bill does. That's what the governor has brought to the table and the legislative leaders, and we're incredibly grateful for that. So thank you again for the hard work of the governor's office, legislative leadership, advocates, and the thousands of Vermonters. You're the reason why we're here celebrating today. And we must continue down this path with resolve, ingenuity, and the compassion that has come to define almost everything that we do here in Vermont. And VPIRG is not only committed to the success of Green Mountain Care, the state's universal and publicly financed healthcare system, but we're committed to keeping Vermonters informed and engaged throughout the process. If we stay focused, keep our eyes on the prize, I'm confident that Vermonters will have this system. We will all have access to high quality, universal, affordable health care that we can count on, and that our little state can help turn the tide for the rest of the country. So thank you again for everything. It's an honor to be a part of this, and I look forward to both the celebration and the hard work ahead.
Thank you, Cassandra. And now we get to hear from the legislators, a few, who made this possible. Before we turn it over to the legislative delegation here in Vermont, I do want to acknowledge the the legislative delegation from Vermont, who is working so hard for us in Washington, D.C. for single-payer health care in Vermont. The best congressional delegation in the country, Senator Patrick Leahy, Senator Bernie Sanders, Congressman Peter Welch. Without them and their team, thanks Dave Reynolds for being here from Sanders' office, I got to tell you, we wouldn't be where we are today. I also want to thank President Barack Obama for his willingness to move the federal date of preclusion from single payer from 2017 to 2014. The president gets it. I also want to thank him for his courage in health care, allowing the federal bill to be a bridge to this system. And this is what the president and Bernie and Pat and Peter understand. The states must and should be the laboratories for change and for reform. As long as we're not reducing standards to Americans who so desperately need health insurance. I am grateful to the president and to our legislative delegation for their extraordinary support in this effort here in the Green Mountain State. I now give you House Speaker Shep Smith.
Thank you. Thank you very much. This is a great day, and it's wonderful to be outside on the steps of the state capitol. I would first like to thank the hardworking members of the House and the House Health Care Committee and the Senate for making this all possible. It's without their work, we wouldn't be here today. And it was difficult work, time-consuming, and required a great deal of political and policy skill. And I think that Senator Claire Ayer and Chair of the House Health Care Committee, Mark Larson, deserve a huge round of applause from all of us. It's amazing that we're here and that we could be debating the fact that there could be something wrong passing a law that creates coverage, healthcare coverage, for all Vermonters. It should be at the very core of what we believe in as citizens. It should be not debatable. It should be a fundamental principle for all Vermonters, but for all Americans. All of the other industrialized countries get it, and thank God we here in Vermont get it too. I would say to those who say this change may bring uncertainty, well, what's it like to face the uncertainty of not having health care coverage at all, or having health care coverage that doesn't really provide you with health care in the first place? That's uncertainty. And uncertainty is figuring out, if you're an employer, how you're going to face another 20 to 30% increase in your health care premiums. How are you going to make sure that you continue to provide health care coverage for your employees? That's uncertainty. I can tell you that uncertainty that brings, having sat in many partners meetings at the law firm that I work in, figuring out how we're going to continue to pay for health care for our employees. That's uncertainty. And the uncertainty that exists with the payment system that we have now. I don't know if any of you have been looking at any of your health care bills recently or your insurance explanation of benefits, but I have 17 years of education and I can't make heads or tail of it. That's uncertainty. This bill is a common sense start to making sure that all Vermonters have coverage, that everybody's got skin in the game, and that we have common sense payment reform that pays per performance, not for number of visits. That's what this bill is about. I want to thank everybody here who has worked so hard to get this bill passed. And I want to thank you now for the work that we're going to have to do in the coming years. This is the beginning. This is not the end. We have hard work to do. There are definitely people who want to see this fail. We cannot let that happen. We need to work together to show the way for the entire country. We can do it. Vermont's done it in the past. We'll do it again. Thank you very much.
Hey, we're pretty lucky to have the best speaker and the best president pro tem in the country. That's not bad, huh? I give you my friend John Campbell.
Thank you, Governor. Thank you, Speaker. I'll tell you, look at this day out. I mean, we've been, fighting 2 or 3 weeks now, solid rain. And then when we're here on the steps of the Capitol, the greatest state capitol in the country, we're graced with this wonderful weather. And hopefully we'll hold off for a few more moments. Let me just say this. My great-great-grandparents came to this country in the 1800s, mid-1800s, and unfortunately, through the years, they decided to leave, and I found myself growing up as a child in Florida. And fortunately, I made my way back here with my family, and I raised my children here. And never in my wildest dreams would I ever have thought that I would be involved in two of the greatest social movements of my life, and I think the lives of most people here. The first came when we took courageous stands to say to our brothers and sisters who are gay and lesbians that they are allowed to marry those who they love and care for. At that time, I thought that was the proudest moment of my professional career here in the State House. But I could tell you, today marks a second part of that. And now, to understand, to be here, and to say to you folks that health care is a right that every American, every Vermonter should and shall have, that is important, and that is spectacular. It's easy for us to stand up here and say what a wonderful project this is and that we're going to keep on moving. But I can tell you this, we are not going to be able to do it without your help. The next few years are going to be very difficult. As the Speaker mentioned, there are many people out there that would love to see us fail. We have to look at them and figure out why. Many of them may have insurance companies or whatever. They're afraid that they're going to lose some business. For that, I'm sorry, but I have to look at people who are walking around without health care coverage, who aren't able to get in to see a doctor, who are suffering from cancer and other maladies that they will not be able to get treatment for, just because we have a broken health care system. We can't sit by, folks. We all have to get involved. And we all have to be ready to fight the fight that surely will be coming over the next 2 or 3 years. So I ask you today to make sure you're with us back in next January when we start the second part of this fight. And we will win. We'll win because it's right. Thank you.
Thank you, John. I'm now going to give you the two chairs of the committees that got the hard work done. While they were doing that hard work, they had some assistance from my team that I'm extraordinarily proud of. Anya, Wallach, Rader. I know who's watching. I did the Wallach first. Bill Lofi, Alex McLean, Sue Allen, and the entire healthcare team on the 5th floor who's been working so hard. Jeb Spalding, I shouldn't have started. Thank you to all. Chairman Mark Larson, we turn it over to you. Thank you for your hard work.
Thank you. I'll make sure that we keep it briefer than the interrogation in the House. I'm really pleased to be a part of today. I'm pleased to be a part of this bill, which will then become law. I never doubted that today wouldn't come. I think the question was just when. The arguments for why our current system isn't working have been around for a long time. People have articulated them for many, many years. We just happen to be in the right place at the right time. I think the arguments about why a reform system can be better have been around for a long time, and people have told those stories. I work hard. I have a 7-year-old daughter. I work hard to try to explain to her why I'm not home very much for a few months. And I told her, so I'm working on this bill, and basically what it's about is to make sure that when people need to go to the doctor that they can. She's like, well, of course they should. I'm like, yeah, I know. And yet our current system allows the craziness of stories like this. I talked to somebody recently who was telling me that their neighbor had fallen down and she had hurt her leg and they had called the ambulance. And just after doing that, she started worrying, have I done something wrong for her? What will happen if she doesn't have insurance? Will I actually have hurt her by calling to get somebody to come take care of her injury? That's a crazy-making story, but it happens all the time. It happens for employers who worry about, if I can't afford to have coverage, what's going to happen to my employees who are sick or who have family members who are sick? In a situation where it's as clear as when somebody needs a doctor, they should have one, it is no longer acceptable that we would accept stories where people are worried about getting the care that they need. And that's the amazing thing I think that we've accomplished in passing this bill. I just want to say a couple of thank yous. The arguments have been around for a long time, but they have only been there because there have been people out in Vermont who've been willing to tell their stories. Certainly the advocates, many of whom sat in our committee rooms for long, long hours, but people across our state who have been willing to talk about the downside of what we do right now and have been willing to make the case for why things could be different in the future. They deserve a vast amount of credit for us being able to be here today. And while many of them are probably working, they can't spend their time here, I think they deserve a huge round of applause. I know that I have colleagues, legislators who have been in this building for a long time who have hoped to be a part of this day as well. And I think that one of the reasons that I have the opportunity to be here today and that we have the opportunity to have this bill signed today is that we've actually have leaders who have been willing to finally listen to the arguments about what's wrong with our system, to listen to the opportunities about what doing something different could present for our state, and be willing to do something about it. So Governor Peter Shumlin, Speaker Smith, President Pro Tem Campbell, you guys have given us the opportunity to do the work that we did in committee, and I'm very, very grateful. Our state will be better off for it. We will be healthier. We will be happier. We will be more secure. And I think we have a lot of work left to go, but thank you for giving us the chance to make things better in Vermont.
Now I want to give the final speaker to you, the chair of the Senate Health and Welfare Committee. Before I do, I was looking at the crowd of legislators here, and it's a big mistake to mention any of them because they've all worked so hard. But there are a couple of P's here that have been waiting for this moment for a few years. So I just want to acknowledge those two P's, Polina and Peterson. Pearson. Peterson has two. Pearson and Plain have been on this one for a while, so we got to give them a little credit where credit's due. I now give you Senator Claire Ayer, Chair of the Health and Welfare Committee, who fixed all the problems in the House bill and brought you this bill. Come on, Claire.
I love having the last word. Thank you. I love having the last word. I think it comes from being the oldest in the family. Before I'd like to put a face on this, on the whole health care issue. We've talked a lot about the economics of it and the fairness of it and the rightness of having health care available for everybody. But first I want to thank two groups of people. And those are the legislators who came before us, who've been working on this for so long, on the healthcare issues for so long, and teed it up with Act 128. Senators Racine and Senator Leddy in the Senate, in my years in the Senate, and Representative Meyer in the House. They did a lot to make sure we had the kind of information, the data we needed on which to make decisions. We couldn't have really gone forward without that kind of setup, and they did a great job. And to the people who held them and us together, our legislative and fiscal staff, Nolan and Jennifer Carby, just kept us going, and they were... We saw a lot of documents from them dated with a timestamp of 1:31 a.m., 2:04 a.m. They really burned the midnight oil to make this happen. I'd like to put a face on this whole issue, and it's something that's just happened recently. We've talked a lot about the economic benefit, especially for the majority of businesses in Vermont. They pay a huge and unpredictable portion of their profits to provide health care for their employees, those that can, and most of those who do not wish they could. This is going to give them more money to invest in their companies, more money to invest in their employees, money to invest and grow. I've been thinking about that a lot since my youngest got engaged and said that they're going to make a decision this summer about where they're going to live. He's an entrepreneur. Having this kind of availability, a surety of price and quality of health care is going to make a big difference on how competitive Vermont is when he's looking out there deciding the best business climate for him. He needs people who can invest, who can change, who can hire and move staff around. And that only happens when you have enough money to invest in your people. We're going to be saving people money by putting this health care bill in place on the health care process. The second personal face, personal face is of my oldest. My oldest lives in California and had our first grandchild 2 years ago. She just put a deposit on a house in Addison County. She can move here because we have an airport, but her husband needs a job. Putting this in place, making the playing field level for Vermont, and really putting us in a better fiscal advantage, our businesses at an advantage over businesses in other states, is going to open a lot of doors for him, and I really look forward to all the chickens being back in the nest. Thank you very much. It's a wonderful day.
Well, you want some more speeches? Or should we sign this bill? All right, let's do it. It's a book of bills. We're going to go over here. We need everybody around. I need Beth Robinson. She actually read this. Right. What do we think it is? 25 today?
26.
26. You work 7 days a week. There's no difference. Hey, a couple of quick announcements. There's refreshments in the Cedar Creek room. You're all invited. Universal refreshments. And if you have any questions, we'll take them.